Hello, Happy New Year, and welcome to Western Perspective for 2021. Thanks for joining us. With the new year comes new challenges. Many of you are demanding a refund for 2020, but will this year be better with so much at stake? With COVID-19 vaccinations dominating the issues and WA state election around the corner, we begin the year with political expert Dr Ian Cook and his observations for 2021.
So 2021 for Western Australians, I think, is going to be about the election in March. The lead up, obviously, is going to be important, but it's the period after that I think is going to be extra important. The Liberals and the Nationals will not win. This will be a Labor win. The questions will be how they respond, how the Liberal and National parties respond to their loss. That will be affected by how big that loss is. If they can keep it relatively small, then that puts the party in a good position. It puts Zach Kirkup in a good position. It's important, I think, for everyone to be patient in the Liberal Party and National Party. So we go into the election, we fight hard in that Liberal and National parties. We are going to lose, but we move forward with a positive attitude. They've got to look toward the next election to regain their position and become the sort of opposition or the government that we need. At the moment, they're just not in a place where they can provide the level of opposition we're looking for. So this election is really important for Western Australian politics going forward. We're looking for a strong performance of Liberal Nationals to maintain their capacity to be a good opposition, put themselves in a winning position next time around, and keep Mark McGowan and his government accountable, transparent, honest, and hopefully good government. The other big, I guess, story, not just for Western Australians but for everybody, is the future around COVID. We're seeing mutation in the virus, and so we've got to expect there'll be openings and closings. Yes, we all thought 2020 was over, and 2021 would be necessarily better. At a policy level, I think we've got to start looking at how to manage this more effectively. Opening and shutting is not, I think, the most effective policy because it is so hard for people to cope with. So I think we're going to be looking at exploring policy options around COVID, maybe being a little bit more creative about quarantining, hard borders. It's worked in Western Australia, we've stuck behind it, but we haven't changed our behaviours to get ready for reopening of borders, given that this virus seems to be mutating, seems to be around. So, you may want your money back for 2020. I'm afraid you're also going to want your money back for 2021 because this is also going to be a tough year for all of us and a tough year for policymakers. I think we've got to see more creative, more thoughtful policy around COVID to be effective in the long term.
And now, AMA WA President Dr Andrew Miller has a COVID-19 update as we begin the new year.
Hi, happy 2021 and welcome back. Hoping to smile a bit more this year following constructive suggestions from viewers. And I think there will be things to smile about, although we still have a lot of COVID work to do. At this stage, my priorities are around improving the situation for prevention of the B117 variant, which has come out of the UK, which is where it was identified, not necessarily where it came from. And this one spreads really quickly in comparison to the standard version of coronavirus, to the degree that it's taken over pretty much in the UK, and in 50 other countries it now has a foothold. And if we get community spread here, then it's likely to be that variant. It does spread through the air. We do need to take more serious aerosol precautions than the government has been advising through their committees. And we'll still keep pushing for those 7 warehouses in WA that contain the proper levels of PPE to be opened up for our frontline hotel quarantine, transport workers and healthcare workers who will come into contact with COVID positive patients from time to time. We will continue to see rolling border closures, I think. New South Wales still has community spread, and very important that we don't get it in here into a very large and very vulnerable state where people have, by and large, gone back to normal living, although people are getting a bit better, I think, on the QR codes. Not very good on social distancing at this stage or staying at home when they got the sniffles. So those are things that will have to dramatically improve. And it was great to see the Premier come out last week and say that people should acquire a mask for use in the community should there be a community outbreak, and it's important to get on with that. 3-layer fabric mask. There's plenty of sites on the internet which tell you how to make one. Go to an authoritative one that's health service based, so that you can figure out what you need or buy what you need. I do agree with the Nurses Federation that the government should be providing these to the public by now. But look, nothing's perfect about this response. There's a lot good about it in the way of border control, disease control and information coming forward. So not here to criticise everything, just trying to improve things. Vaccination just around the corner, that's a terrific thing. And so we will be getting vaccinated. Everyone will be getting vaccinated, hopefully at some stage during 2021, starting with the most vulnerable. There will be continuing discussion around which vaccine and who goes first and that sort of thing. But those discussions shouldn't put anyone off. In the end, we've got some really good options and then maybe some other really, really good options. So we need to carefully have those discussions with government. We're not doing this to give fuel to the anti-vaxxers. In fact, quite the opposite. When the public see that we have a scientific discussion around the best way to proceed, and then we all agree to proceed and go on with it, I think that gives people confidence that this isn't being rushed, that it is being considered carefully, and that we have looked at all options. And that's what we're asking the government to do. Is to look at all the options and explain it very clearly to people, because we want this to work right the first time and save as many lives as we possibly can. And certainly these vaccines in the field seem to be out there saving lives at the moment in the countries where they're being used under emergency authorisation. So there'll be more about that, but look forward to getting vaccinated. In the meantime, stay safe. Welcome to 2021. We're all going to smile a lot more. And I hope that you and your family have had the chance to have a bit of a rest. And if you haven't so far, hopefully that will come up during this year, because it's important we all look after each other as well as ourselves. Thanks for your time.
Dr. Andrew Miller there. And that's all for the first episode of WP for the year. We'll be back again next time, but for now, it's back to you.
Thank you, Nelson. And that's our weekly news and current affairs. For news at any time, go to our website at wamnews.com.au.
From Sarah and myself, we wish you good health and good night.
Take care.